Hello, I'm Suhail Mirza and welcome to this episode in Season 2 of Voices of Care. My guest today is the CEO of the Northern Ireland Social Care Council, Patricia Higgins. Patricia, thank you for making the trip to join us. It's a pleasure and an honour to have you on Voices of Care.
And it's lovely to be here today. Thank you.
You are very welcome. Now, most of us know the role of a regulator, but can you expand upon it? It's a very interesting time for social care and for the Social Care Council.
Yes, so the Northern Ireland Social Care Council is the workforce regulator for social workers and social care workers in Northern Ireland. And we have around 46,000 people on our register, and of those 38,500 are social care workers. And as a regulator, we're obviously responsible for registering that workforce. We will investigate allegations of misconduct or allegations about fitness to practice. But we have statutory functions around workforce development, which is a really strong focus of the work that we do. So we set the standards for social work, education and training, both at qualifying and post-qualifying levels. And we also develop occupational standards that underpin social care qualifications. And we're required then to ensure that there is the right range of learning and development available for both workforces. And so we have a very well developed digital learning zone on our website where we will develop resources to support the upskilling of the workforce. So we've got quite a broad range as a regulator, and over the last number of years we've also been working at how we position ourselves within the system as a system leader.
And you've chosen an extraordinary time. I think you joined as an interim CEO back in June 2018, yes. COVID, all of these things. Yes. And the sector itself, as you said, it's the numbers registered. Yes. It's a big contributor. People tend to forget to the economy in Northern Ireland. Yes,
it is. And we did a piece of work a number of years ago, actually, which said that it was something like £851 million of gross value added to the Northern Ireland economy. And quite often when people talk about social care, they almost see it as a cost and a drain. And what we wanted to demonstrate was that it was a major contributor to the economy in all sorts of ways, not just financially, but in supporting people who are carers, who will be able to return to work if you've got a good social care system that can support that, and also ensuring that we are supporting the citizens of Northern Ireland. So social care is a contributor to the economy, and we are about to do some further work to try to bring that work up to date.
Now, the sector across the UK, we've had been the privilege of a number of the leaders across social care across the UK, and it is a picture of opportunity, but tremendous pressure. It's no different in Northern Ireland. I wanted you to just touch upon the workforce in terms of the pressures that are prevalent. I know you've got a new strategic plan which we'll touch upon, and workforce is central to that. But just to get your overview, there are some tremendous challenges. I think a system under strain is what Paul Martin, your chair, described it in your strategic plan.
Yes, that's right. I mean, it is a system under strain, and the whole of the system is under strain in terms of health and social care. But I think, what we're experiencing in Northern Ireland is not unique to what's happening across the rest of the UK. I work with my colleagues in the other parts of the UK as part of an alliance, and we share the same concerns about workforce pressures and delivery of service. So so Northern Ireland is not unique, but it is struggling in the context of social care. So when you talk to providers, the single biggest issue for providers is recruitment and retention. And they invest a lot of their time and obviously cost in recruiting social care workers. So, getting people into the sector and more importantly, holding people in the sector is a real issue. And I think over the last couple of years, we have started to try to turn our attention with providers to, what are the issues? Why are people leaving? And how can we then help to retain the workforce and build a sustainable workforce going forward? And someone said recently to me, you can't recruit your way out of a retention crisis. And I think that's absolutely right. So we are working with providers to understand, and with the workforce to understand, what are the challenges. And the challenges, again, are the same that you will have heard from other colleagues in other parts of the UK. So terms and conditions of employment aren't good, as we all know. Social care workers are paid a very low rate, issues to do with support and supervision, issues to do with access to learning and development. All of those are, and the complexity of care now and the complexity of need as people live longer. The social care has changed in terms of what it needs to deliver, and therefore for some people when they come into social care that might not have been what they expected. So we need to make sure that people understand the role they're coming into and then they're well prepared to do it.
And the key thing, as you say, the complexity of the skills required is also a function of the broader picture. If you look at Northern Ireland in terms of demography, the stats showing I think it's going to the whole population as a whole 5.7% in the 25 years post 2018. Big jumps in the over 65s, over 85s. I think that brings its own pressure. Social care and healthcare often seen differently, but I think it was Robin Swan in his foreword to the Department of Health consultation on adult social care reform said, social, and I quote, social care is every bit as important as healthcare. And it's going to become even more, because I think the estimates are of 20,000 additional care packages in 2037 compared to 2016. So these pressures aren't going away.
The pressures aren't going away, and interestingly, we've just had a recent census, 2021 census, and the figures came out this year, and we've had a 25% increase in people aged over 65 from the previous census, so in 10 years, and the reports are that it's 1/3 of our population are 65 and over. So there's an unassailable case for building a sustainable social care workforce going forward, because we are going to need social care. So yes, our demography is an ageing population, and we really need to think about investing in social care properly.
Absolutely. Now, that brings us on to your strategic plan for 2023 to 2027. But before we dive into that, it's a really important document. If you could set the context, because Northern Ireland, interestingly, for at least the last decade or so, from the Compton Review in 2011, the Bengoa Review, which I think called the system broken, and Des Kelly's work, Power to the People Review, there's been a lot of analysis, and the Department of Health issued its strategy in response to that. So this doesn't come in a vacuum in terms of what you're putting, but it's been a decade of really trying to grapple with these challenges.
Yes, we love our reviews in Northern Ireland. We have lots of reviews telling us what we need to do. So you're right, Bengoa, the Bengoa Review looked at our health and social care system, although it largely shone its lens on health, and it was looking at really what we needed to do fundamentally to change the system. Out of the Bengoa Review, the Health Minister then developed a strategy called Delivering Together. But because Bengoa had focused more on the health part of our health and social care system, the department then commissioned Des to do the review part people. And that was a really focused review on social care. And it clearly was highlighting the real issues that are around in relation to social care and what we need to do. So he was highlighting the fact that we need to value social care, and that we don't place a value on social care, either within our system or indeed in terms of public understanding of what social care is, that we absolutely need to build our workforce and focus on our workforce, that we need to focus on family carers as well, because family carers are a large proportion of providing care in Northern Ireland as they are in other parts of the UK. And the other thing he talked about as well was we needed to maintain our integration. In Northern Ireland, our health and social care system is integrated. So health and social care trusts deliver health services, but they also deliver social care services. And I know there have been debates in other parts of the UK about integration. But there are challenges with that, as we all know, because acute services and hospitals in particular tend to dominate, and they do dominate in Northern Ireland. And so if you've got an integrated trust, in terms of pressures on budget, acute services will take some of that budget on, and there's not as much budget for everybody else. So there are real challenges in terms of the delivery, the system of delivery, but there's also real opportunities in an integrated system for looking at how we join up our services and how one service supports the other. So in the context of social care, we've all heard this, not just just in Northern Ireland, the link between delayed discharge and social care, and the issue about having availability of social care packages. But there's an opportunity, I think, with integrated services to begin to think differently about, well, how do we reinvest our resources, and how do we think about putting our resources into prevention and early intervention services, which might then divert people from ending up in acute care, or at least keep them out of that for a longer period of time, and use social care there in a much more preventative way, as well as obviously using social care when people really need it at the other end of coming from acute care or end of life care, for example. So our integrated health and social care system gives us those opportunities, and the department under the Permanent Secretary are leading a transformation programme now, and definitely those opportunities are there as we look across the piece in relation to how do we really deliver social care that supports the rest of the healthcare system.
It's something that I'm sure that us here in England will learn from. As you know, we've put on a statutory footing our integrated care systems. I think from memory, correct me if I'm wrong, I think it was the McCrory report in 1970 that set that integrated framework. So plenty for us to learn. So out of this, and the Des Kelly review, I think, where he makes one statement, I think, going to your point earlier, and he simply says, and I think I quote, "It is plainly wrong to see social care only as a cost." Yes. He says that very, very clearly. Yes. And your strategic plan, there's so much in it. We could be here covering so much, but I really wanted to focus on the priorities that you've identified. The mission is to improve care, yes, but it's been a powerful piece of work that you've worked very closely with.
Yes, so I suppose our new strategic plan is building on a lot of the work that we've been doing, and over the last number of years, it's really interesting when you're a workforce regulator, because you, in a sense, have a helicopter view of your system and those that you're regulating and the system that they work within. So we've spent a lot of our time over the last number of years really listening carefully to our registrants, whether they're social workers or social care workers, and listening very carefully to the providers of social work and social care services. And I know we're talking specifically about social care today. And we have had, in relation to social care for a number of years, a Leaders in Social Care partnership, which is a partnership of the council made up of providers across the system of social care, who provide sort of advice and guidance to the council, particularly in relation to workforce. So as part of that sort of working in partnership, which is in our DNA, it's how we do our business, and listening to the issues that are emerging, we, I suppose, have found ourselves in quite a unique position within the system. So we've been able to influence up in terms of government. We've been able to make connections across the system where we see something really good happening in one place, and how do we connect that across the other. So the strategic plan we're trying to take that work a step further. Obviously within that we are we're a regulator, and we want to ensure that we deliver excellent regulation services, so that our systems are excellent, and we're really focusing on innovation, so that we can make sure that our registration system is cutting edge. We're looking at how we effectively deliver our fitness to practice processes, but one of the biggest areas I think that we've been really focusing on is the workforce development piece. Yeah. And in the context of the reform agenda and the work that we've been doing, we have been commissioned by the Department of Health to do work around career structure for social care, and creating a CPD framework and linking a career framework to qualifications. We don't have that career structure in Northern Ireland for social care, unlike what you would have in social work. And so that's the work we've been doing with providers and with registrants over the last couple of years, and we're sort of coming to the end of that now. We have what we call our care and practice framework. Yeah. We've got a very simple career structure, our career framework, which is a practitioner, a specialist practitioner, and then up into management and leadership, where we feel there does need to be a lot more investment in terms of that management and leadership role. And we are in the process of developing an entry certificate qualification. So for us in Northern Ireland, social care workers are not required to hold a qualification to be registered. It's not a qualifications-based register, but we would like to get there. And the entry certificate, I think, over the next number of years will help to take us there. And then people will have CPD opportunities and other vocational qualification opportunities as they progress through their career, and that can be tailored to whatever the programme of care is. So we're not specifying what that CPD or qualification level would necessarily
be. There's quite a lot of innovation
be.
And flexibility built in potentially in how to upskill and allow multiple pathways to train, because that's going to need to adapt to a different workforce. That's right. Also honours the fact that actually people are required to do a lot more complex tasks.
Yes, and that's the beauty of this. We want to make sure that it's a flexible framework that will respond to changing need, because clearly need will change. And you've talked about the increase, the changes in demography, and people living longer and therefore with more comorbidities, and social care providing supports to that. So our aim is that this will flexibly fit whatever employers and whatever the programme of care is. And when we've engaged a lot with registrants, with social care workers around this. I
was going to ask you, just because part of your consultation around this is to co-create with the workforce itself. And I wanted to touch upon your, because I think it's relevant here, your Voices of Social Care Workers survey, and what came out of that. Obviously, pay in terms were high on the agenda, but there was two other issues that really struck me were the importance of equality and diversity that should be reflected, and also the health impact of doing this work.
Yes. I mean, I think for social care workers, what's very clear when we do work with social care workers is they are highly committed to providing care. People come in to the care profession because they want to care, and they come in for altruistic reasons. But the difficulty is if they're not properly supported, if they aren't given the opportunities for learning and development, which will help them to develop the skills to deliver the care, then they feel really overwhelmed. And that's when you get into issues to do with health and well-being, where people feel it's just too difficult and they can't do it. And the pressures also of time and task in home care, for example, where people don't feel as if they're rushing, they're under pressure, they don't have enough time to provide the care that they want to care, and all of that then will lead to the issues we were talking about at the start about recruitment and retention and why people want to leave. So, we have to listen very carefully to what our workforce are telling us, and in working with providers, those are the issues that we really need to begin to address. But what we also know from engaging with our social care workforce is they are really hungry to learn. They understand the importance of learning and development. They understand the importance of having the right skills and knowledge and values in order to, and what they want to do is to deliver the best care that they can.
And just to expand upon that, because it's interesting to say that demography requires greater numbers, and also with people from different parts of the system. So you're really talking about, it's easy to say, but to deliver training which is personalised, flexible, and perhaps even micro-learning and credentialed. That's going to be, that's a big task that you've got ahead of you, which will require maybe use of digital training platforms to allow people to be flexible?
Yes, and we're going to have to think about all of that, because we're going to have to provide learning and development that is easily accessible, and I think that's one of the other issues for social care workers. And as I said to you, we have a digital platform and a learning zone, and we will work with providers to develop bespoke learning that people can easily access. But you're right, we're going to have to look at all sorts of different ways of ensuring that people can access learning to help them on the job, so that they feel confident and competent in delivering the care they want to deliver.
No, absolutely. Now, you talked a lot about integration as a thread that's run through in Northern Ireland, sometimes imperfectly, as you would expect. Looking ahead, I'm interested in the work that's come out in terms of with the Department of Health and this creation of the Social Care Collaborative Forum. If you could talk a little bit about that, because I think that's potentially a platform which speaks to this idea of all stakeholders having a view, and it's very much a values-based in terms of a rights-based approach.
It is. So the review history that we were running through, and we got as far as Power to People. The department then, following Power to People, pulled together a set of proposals for the reform of adult social care and consulted on those and got a very strong positive response to that. So that's now really the blueprint for moving forward in terms of reforming adult social care. At the beginning of the year, we ran a workshop with a range of stakeholders, government, providers, people from the technology industry, a whole range of providers, to begin to say, what can we start to do here to move things forward? Because at that point there was quite a bit of pressure around winter pressures. It was in January. And we did the workshop with NICON, which is the Northern Ireland branch of the NHS Confederation. So we did a rapid action workshop. And out of that workshop came a really strong call for some type of collaborative forum. And the department were present in the room, and they felt that this would be a really important way to move forward. So, for the very first time, we have established a collaborative forum, as you said, the Social Care Collaborative Forum, which is made up of representatives from provider organisations, which is made up from representatives of service users, carers, trade unions, government, representatives and ourselves. Collectively in the room to begin to see what can we do to move forward with the reform of adult social care and the proposals which the department have. So what we've done is we've established a set of work streams running from that collaborative forum. We've agreed this with the forum. So we have one on workforce. So we are looking at how do we begin to develop a workforce strategy, and obviously feeding in the work that we've been doing around career structures. We have one on maximising capacity. So looking into this winter, what can we do to ensure that we can assist the hospital discharge issue, both into care homes and out into home care. So there's work happening around that, and also beginning to think about how do we change the model of home care into the future, and looking at a new model for home care. So we're doing some work around that. We have a work stream on communications, because we've been doing a lot of work around promoting the value of social care.
I was going to say that's a fundamental part of the remit, is promoting it as not just something that helps the NHS equivalent, but actually stands on its own feet, deserving of its parity of esteem.
That's absolutely right. And we have a campaign running that the department have funded us for, called Making a Difference. So we have done a lot of promotional videos telling the stories of social care. We have podcast series called Care to Chat, which is opening up the dialogue about the nature of social care, because I think people do not understand its breadth, and the lens for social care tends to be down the sort of issues to do with hospital discharge and older people. And yes, older people are the larger proportion of people who receive social care, but obviously social care is across all programmes of care, people with disability, people with mental health issues, etc. So, we want people to understand what social care is and does, and what its value is to society as well as to the system. Some of the other work streams we have are looking at contracting commissioning, because clearly that's an issue in the context of commissioning out services, and that's something that we really need to take a long hard look at. So that's another really important work stream. And we've just introduced a couple of others. We want to look at family carers and the role of family carers and the supports that they require, and also our supported living sector. We have a work stream around that as well. So we've collectively identified what the priorities are. It's early days. It only started in April. We recently just did a workshop with our forum around building relationships and building a collective leadership approach, because what we're saying is these are the system leaders. But one of the other really important pieces around this forum is that the permanent secretary, he has a transformation programme running, and in that transformation programme there are things like cancer services and hospitals, etc. He has brought the Social Care Collaborative Forum in as a programme board, and it's sitting alongside all of those other transformation programme boards on an equal footing effectively. So no longer is social care sort of a bit of a Cinderella. It's now sitting right at the top table, alongside all of the other, knit into the transformation programme, which in a sense takes me back to where social care can support the rest of the system. So it's exciting. Now it will take time to yield results, but it's the first time that and I think the department recognise they can't do this on their own. No one can do it on their own, and there's such a willingness in the forum from all concerned to roll their sleeves up and get to solutions, and that's what we're going to try to do.
So we've moved from review to redefining reality.
We've moved from review to action, I think.
On that very refreshing note, which I think should have some resonance for all of us in tackling these health and social care issues. Patricia Higgins, thank you for your candour and for your wisdom.
Thank you very much indeed.
My pleasure. If you've enjoyed this episode of Voices of Care, please like, follow or subscribe wherever you receive your podcasts. And if you want to find out more about how we are truly enabling the healthcare workforce of the future, please visit newcrosshealthcare.com/Voices of Care. In the meantime, I'm Suhail Mirza. Thank you very much, and I look forward to seeing you on the next episode.